Are you curious how you can be proactive about reducing your risk of operative delivery, C-section, and maybe even shortening your labor and making it more comfortable? Well, that's exactly what we're going to talk about today with my very good friend Vicki, who is our Spinning Babies champion. I will put a link below to the Spinning Babies website because a lot of the positions that we talk about here, we got directly from there. It's a great resource to go ahead and start doing in pregnancy to help make a more comfortable pregnancy, get baby in that optimal position so that you go into labor on your own. You can avoid an induction possibly. There's so many benefits. Check out their website and see all the list of benefits and everything that you can do. I'm Haley. I'm a labor and delivery nurse, a childbirth educator, certified breastfeeding counselor, doula, and mom of 2, soon to be 3. And we're going to talk about those positions that can really help to do all those fun things we talked about. So without further ado, Vicki, so I just got to the labor and delivery department. I'm contracting every like 3 to 5 minutes, uncomfortable, and I'm having a lot of back labor. So let's start with the forward leaning inversion. Forward leaning inversion, I love it. Okay, I'm gonna take my shoes off. All right, so how do I do this forward leaning inversion, Vicki?
So yep, you'll go on your knees facing me.
Okay. And can anyone do this?
Unless you have high blood pressure.
Okay,
it's not recommended with those.
Yes, so unless you have high blood pressure, you should be able to do this. You can show this video to your labor nurse, or you can have your partner help you do it as well. You can do this at home or when you get to the hospital. Okay.
Put your hands down here, and I want you to slowly bring your hands down to here.
Okay.
And then ideally, once you feel a little comfortable, if you can go down onto your elbows.
Okay.
Perfect. So we're looking for a nice straight back here, which she's got. We're going to try and hold this for about 60 seconds. And nice easy breaths.
Now, should I be doing this with a contraction or in between? Either or, right? You could do them either. If you can catch a contraction, great. If not, that's okay too.
Okay.
Now, how do I get out of here?
All right. So when it's time to come out, you're going to go back up onto your hands. And then back up onto your seat. Good. Now you're going to finish this off by bringing your arms straight up over your head. Nice deep breath. How do you feel?
Not too bad. That actually was easier than I thought it was going to be.
Good.
Another rule of thumb, if you're having someone help you, if you get to a place where you feel like you're uncomfortable and you can't have them help you up, you can always just crawl off. Okay? And plie and squat. I'm just kidding. Don't do that. Okay, and then the next thing that we're going to do is, what should we do next?
I would say sideline release.
Sideline release, okay. And to do a sideline release, you can do this either with or without an epidural. And what position do I want to be in, Vicki?
So you're going to lay on your side facing me.
Okay.
I want you to scoot your hips all the way to the edge of the bed.
Okay.
Very good. And we're going to make sure that she is nice and lined up. Do your shoulders feel? So we want them stacked not only this way, but also this way.
Okay.
Okay. So nice even line all the way down. Hips are nice and stacked.
So you're standing like a strict soldier,
Mm-hmm.
right? Okay.
All right. So now this leg is going to come up, and we're just going to let it hang off the side of the bed. And you want to be real careful, whoever's supporting you, not to let them have you fall forward. We want to stay nice and relaxed, nice and even.
And so here you're literally just supporting me so that I don't roll, and so my hips stay stacked,
Yep.
correct? Okay. And then will you do this through 3 contractions?
Yes.
Okay. And then at the end of 3 contractions, I don't help you lift. I don't lift my leg, right?
So your support person will bring it up when it's time.
And then what's the point of this?
This is going to relax any of the pelvic floor muscles, anything that's really tight, helping baby to get into that perfect position.
And the ligaments, right? Okay, perfect.
So now we're going to switch sides. Whatever we do on one side, we need to do on the other side so it's nice and balanced.
All right, so we would do the other side then, but since you've already seen one side, we can assume that you're a smart individual. You can figure out how to do the other side. So we'll move on to the next position, which is one that I really like when you're in active labor or you're even transitioning without an epidural and you're really trying to get baby to drop into the pelvis and you're trying to get things moving even quicker. Another thing is, if you think about it, anytime you're leaning forward, the heaviest part of baby's head, so the back of the head, is going to be encouraged to rotate to the front, which is an easier position to help deliver. So I like to do the back of the bed all the way up like this. And you can do this with the epidural as well, as long as you have good movement in your legs and good support around you. Some beds have this railing, some beds don't. You can lean over it and just rest in between contractions, or even come back and kind of sway. And you're just thinking you're going to use gravity to really help put more pressure on the cervix, encourage you to dilate, encourage baby to get in a better position, and speed things up a little bit. All right. After that one, what's the other one? Abdominal lift and tuck. So this one is also from the Spinning Babies. So we'll go over to you can go to a wall or a door.
You might want to do the door.
Yeah, let's do the door. So you can either do this against a door. I recommend the bathroom door so someone doesn't walk in and hit you, or against your partner. But what you're doing is you're literally just leaning against the door, and you think about, you want to turn, here I'll do it this way so you can see better. You want to think about tilting your pelvic bone underneath like this, or your tailbone underneath, like tucking your tailbone underneath and lifting your baby up through 3 contractions. So you do it through 1 contraction, and then you let everything relax, maybe just do some swaying and kind of loosening up the hips, and then through the 2nd contraction you hold it through the whole contraction. And sometimes it can get pretty hard, so you may want to have a partner or someone come and help lift for you. So Vicki, you want to be my partner and lift for me?
Yeah.
Because sometimes it gets like, oh, I can't even hold my legs up, but I'm trying to lift, so you go ahead and do it for me.
Always done it from behind.
Oh yeah, you've done it from behind?
Yes.
Oh, okay. That's how we got in this position. Hey, oh, just kidding. Okay, so you can be leaning like this and have someone lift it from behind like that. And basically the purpose of this is to help engage baby, have baby tuck its chin and engage in the pelvis. It can be quite uncomfortable, but there are comfort measures and then there are progressive measures. And this is something that's going to help your labor progress. What's another one we can do? The ball. The ball. Let's use the ball. Love it. Okay, so here's our lovely ball here. You want to make sure that you feel supported on the ball. You can do figure 8s. Really get into that pelvis and loosen everything up. I also like to stack some pillows here and rest on it and sway back and forth. And you can have your partner or your labor and delivery nurse do like counter pressure, or you want to do counter pressure and maybe like a double hip squeeze and show the difference. Okay, so I'm having some lower back pain, and now my labor and delivery nurse or my doula or my partner is just going to do some counter pressure, and that really just helps to loosen up everything in that area. It can help kind of create or open the diameter of the pelvis so that you get a little more room in the back. And then the other thing is the double hip squeeze. So what you're looking for is like the crest of the hip or a little bit lower, and you're just doing a static hold during the contraction. So what that does is that opens up that diameter of the pelvis and gets baby off that tailbone, especially if baby is facing sunny side up. That's really helpful and can feel really good. Don't stop. Usually, if that feels good to a laboring woman, she'll want you to do it through every contraction. So that's like your pocket ace. Wait until you really need it, because if you start too early, like my husband, your arms will be dead by the end of labor, like my first one. The other things we can do with the ball, I mean, it's kind of endless. You can bring that in the bathtub with you and sit on it and use the shower head to just do some hydrotherapy and on your belly and help it really relax. What else with the ball? You can also do little like hip rotations, figure eights with your pelvis. You think about making an 8 with your pelvis, I mean, like it says. And then the last thing would be, you could kind of do this same thing in the bed as you did leaning over, except for you'll be facing the other way, but I'll face this way for purposes of filming, where you can just rest on the ball like this in between contractions, and then maybe like when you're having a contraction, come up, whatever feels good to you. Ultimately, you want to listen to your body. What is your body telling you to do? Are you having more pain in one area than another? Are you feeling, does something feel good to you? Don't be embarrassed about what you do in labor, because it helps bring your baby out, and being in labor is a safe, natural, normal process. And partners, if you're watching this, make sure if she's doing something crazy like figure eights or something, don't look at her like, what the hell are you doing? Because she's not going to be very encouraged to keep doing that. But if you're like, that's amazing, you're doing so awesome, I'm so proud of you, I love you so much for bringing our baby into the world, all of that's going to do is help to create more of the hormones that she needs to cope in labor. So I hope this video is helpful. I'll do one following this about pushing positions, so stay tuned. But don't forget to like, comment, and subscribe. And remember, you got this.